And on to palpation and joint mobility testing. So, when it comes to palpation, I know that you have um, gone through most of these landmarks and palpation in prior courses. So, generally, I'd like to take this time to just review these different areas of palpation. But that being said, I know that you have your other material available and can review how to palpate these different landmarks. Now, that being said, little note here on the symphysis pubis or the pubic symphysis. Generally speaking, it's a good idea to get comfortable palpating this. And you can go about this a few different ways. Generally, it's used to palpate for symmetry and tenderness. So you might ask your patient to palpate just below their belly button, push into their stomach, and then they can move down or inferiorly until they find bony prominences. And a common cue that I'll use to patients is try to feel for a little bony landmark. Should be just above your groin. So with that, if you're uncomfortable talking to your patient or palpating your patient, then your patient's going to be uncomfortable. So make sure that you're able to do that without making your patient uncomfortable. Now, you can have your patient find that, put your fingers over your patient's fingers, and then have them remove their fingers. You could look at symmetry by putting your fingers on the patient's fingers and trying to palpate and look at without actually touching the patient's pubic symphysis there. Or you could locate those landmarks yourself, let the patient know that you're feeling for bony landmarks just above the groin, and to let you know if you go too far, but start palpating just below the umbilicus and slowly move inferiorly until you find those pubic symphyses. So different clinicians have different ways of doing this and different comfort levels with how they go about doing this. That being said, the biggest thing is to be comfortable with it, where your patient will notice your discomfort and also be uncomfortable. And our soft tissue structures, again, I know that these are structures that you palpated before. One area that I want to point out that you might not have palpated before is the inguinal ligament and the surrounding soft tissue structures there. So one of the reasons it's important to find our pubic symphysis is so that we have that in reference to the ASIS and we can palpate the inguinal ligament. So finding that pubic symphysis, we work more laterally away from midline, follow along that inguinal ligament, and it's important to palpate along there because we might find a little herniation, or we might find inflamed tender lymph nodes as well in those areas. So it could indicate a need for referral. So it can be important that we palpate this area for our patients here, especially with hip pain or pain in that area. So considerations for palpation in the thoracolumbar spine, there are anatomic variances. So that being said, if we find that one spinous process is a little lateral to the adjacent levels, that doesn't necessarily mean that the patient's in a rotated position in that segment, which commonly you'll hear. But a lot of times spinous processes can just be off at an angle, and that's not an indication of the resting position of the rest of that segment there. So there is some anatomic variation, also sacralization or lumbralization, which I talked about in the IRA-TIRA video. And also there's questionable reliability when it comes to locating different segments. So with students, it's been shown that there can be some difficulty in identifying L5, or poor reproducibility, or that reliability between different palpators. And that being said, inherently, if that improves, or if that's better with clinicians, which it was in this study, that implies that people get better over time as they palpate. So this is something that takes practice and might not come right away, but sticking with it and practicing can be very important for improving your palpation skills. So don't get too frustrated if you don't feel like you know exactly where you are as a student, as a new clinician, even.